this happened for a short time. But bear in mind that in other places, including the United States, several places have been shut down for a longer period of time and in fact persist. This morning, I understand it was a record set in terms of number of people that were diagnosed just this morning. So it's in fact getting worse in the United States, and it's something that has to be dealt with. So it is true that situations like this have existed previously. We know of Ebola, which affected Nigeria and other places. Yet a global spread such as this is relatively rare. The last one, which is the Spanish flu, reportedly goes back to early 20th century. Today, this interaction between the medical profession and the media provides immense opportunities to craft and tell the story in more effective ways in service of Nigeria and perhaps even beyond Nigeria. The medical professionals are the pandemic experts. There is no question about that. They know far more than the rest of us what the rest of us face from this scourge, what it is, how it manifests, how one can be prevented, what can be done when it is encountered personally, and much more. That knowledge is critical, in my view. Yet, without the media professionals, that knowledge and its simple and effective understanding cannot reach the Nigerians that urgently need it. The media professionals know how to get the important points across to the mass of Nigerians. But without the medical professionals, that would be challenging. That is why we need this marriage today. Therefore, one hopes that out of this event today, along with similar events, that both the medical and media professionals can create an ongoing channel of communication for the benefit of all Nigerians. This means a better understanding of this pandemic, how to best tell the story, how best to engage the rest of Nigerians. It is a tall challenge, I'll make no mistake about it. But given the brilliant minds in both professions, this is a challenge that you can handle with great success. I wish you the best in making this meeting of the minds a fruitful one, with the understanding that this is a meeting beyond those who are at this event today. It is, in fact, a meeting for the good of all Nigerians. Thank you.
Thank you so much, Professor Chuka Onweme, the immediate past chair of the Department of Strategic, Legal and Management Communication, Howard University, Washington, D.C., a teacher of teachers, and of course, a great communicator. Of course, we have Professor Olumuyiwa Odesoni, a well-published professor of public health, and of course, the director of Research and Innovation, Lagos State University, is also standing by. We'll be having, his own slide or conversational discussion on this topic. I also have the HOD of Community Health and Public Health Department of the Lagos State University Teaching Hospital. I'm talking about Dr. Yinka Adeniran. So sorry about that. And of course, I also have a friend of mine, Dr. Alero, and she's of the Lagos University Teaching Hospital, LASUTH. That's Dr. Robert. Please welcome and stand by. Of course, I also have here the first professor of mass communication. I'm talking about the first female professor of mass communication in University of Lagos, a teacher of teachers also. And of course, she'll be giving us a very short opening remarks. That's Professor Abigail Ogwesi of Mass Communication Department, University of Lagos. Prof, are you there?
Yes, thank you. Yes.
Yeah.
Can I go ahead?
Please go ahead, ma'am.
Thank you very much. Professor Ngumachili and the rest, the most senior professors, and those of health and communication present, other colleagues in the media industry and public health experts. It's a thing of joy for me to be here this afternoon again on this platform, afternoon from Nigeria.
Excuse me.
Given the fact that we're in the stage of community transmission of COVID-19, then it's obvious that we have to begin to talk about communication, because the community transmission is driven by human behavior. They are more behavioral. And like Professor Ngumachili said, we are now looking at the interplay between medical sciences and communication. And so we will be talking about the risks, poor risk perception that happens and amongst the community people, among citizens. And given the fact that most of the things that have been driving our conversation has been the demand aspect, telling people to go and do tests or to use Of course, one thing that has dominated debates or discussions concerning health, particularly from the supplier's perspective, it's the absence of PPE, that they don't have access to protective equipment, personal protective equipment. But nobody really talks about their mental health, the state of their families, their remuneration, and what happens, what they are going through. Even the sheer volume, the number of people they have to attend to, other diseases that they are attending to beyond COVID-19, there are things that we need to talk about. And so what are those issues that should drive reportage? I think that those of us from the media industry should begin to do a gap analysis of our communication of issues that we have been reporting, and that will now begin to drive conversations. And only until we begin to do that, to also see the health professional, that there is something that the health professional is suffering from, beyond the fact that it's a skilled worker to render services for us to contain the pandemic. We should also be thinking about them, their mental health, their families, you know, the number of patients they have to see, the end condition under which they work. I think that given the fact that the media is strong, the opinion leaders, the incident commanders, the petroleum and the presidential task force against COVID-19, all the incident commanders, most times they don't get to each of the participant group, be it health workers or the citizen. They get issues they deal with mostly from the media and get their experts to be at work. So we as media people, we have to help those people at the supply end. And I think that we should begin to look in that direction of our communication activities. Thank you very much.
All right. Thank you so much, Professor Abigail Ogwezi, the first female professor of mass communication in University of Lagos. And by the way, that's my immediate past HOD. Somebody just sent me a message that I didn't introduce myself. My name is Dr. Nwana Samuel Akman. I lecture in the Department of Mass Communication, University of Lagos, and of course, an award scholar. Thank you so much. Now we'll move to Dr. Kazim Akinreti. Dr. Kazim Akinreti is the NUJ chairman in Lagos State, and he's going to be talking to us just briefly, and then we declare the floor open. Dr. Akinreti, are you there? Dr. Akinreti is also, I think, the Deputy Director, News, Voice of Nigeria, Lagos. Dr. Akinreti, are you there?
Yeah, very well. Good evening, all. Hello.
Hi.
Hello. Yeah.
Hello,
good,
we are
good
here. Go on.
Go on. We can hear you.
Yeah,
Okay, that's fine. Dear colleagues and senior colleagues, both in the media and also in the medical profession, I thank you. It was a great opportunity to be with all of you. I think the issue we are discussing today, strikes the balance between the media and the medical profession. More importantly, the media has tried as much as possible during this COVID-19 to put so many issues, on the front burner. And of course, beyond the equipment, we also saddle with responsibility of how we journalists are also coping, reporting COVID-19. And some of us have fallen victims of COVID-19 already. Aside from the mental torture, some of us also had the problem of even relating with our relations when we get back home. Because when you go and cover press conferences of these isolation centers, you're also at risk. And unfortunately, none of the media organizations also ensured their reporters who went to cover these COVID-19 press conferences. And so it's almost a double jeopardy that the media that been having coping with challenges of payment of salaries, loss of equipment and environmental hazards, has also to cope with the issue of COVID-19. What is striking? What is important for us as a media person? I believe media as a social service, we all go out to ensure that we inform the people adequately, we educate them, and want to entertain them. You can see, despite the challenge you have, media organization has provided, free airways for most of the messages on COVID-19. Free of charge, without any of these paying a couple. And this is part of our social responsibilities. But far more important is how media is able to uncover some other areas. Like, for example, now we are tracking the funds. We are tracking the money that was sent, for COVID-19. The donations. It's still a major challenge, because by avalanche of the money that have been received, you just find out that we are not still giving enough attention to the COVID-19 in terms of the curve coming down. Lagos, for example, has done very well, but other states has not done so well. And so the media is tracking this fund. That what happened to all the amounts of money that were donated by individuals, corporate organizations, for us to address the issue of COVID-19.
All right. Thank you so much, sir.
Media today is how well can media be able to sustain all the campaigns, to ensure that COVID-19, the incident cases are reduced in Nigeria. Now that we're not having enough tests. With all the money, we don't have enough testing for our members to determine their status. This is very, very unfortunate.
All right. Thank you so much, sir. I think we've taken note of that. And then one more introductions, and then we'll leave the floor. Then Professor Odusonia will start his first presentation. It's going to be very conversational, so that some of us journalists that we are very scared of statistical analysis and all of that will be able to relate with it. And the last person that would give an opening remark is a corporate communication guru, an expert in corporate communication, and of course media production. He's also the AGM training corporate communications and operations. I'm talking about Mr. Kingsley Uranta, who is the AGM training corporate communications and operations in Channels Television. Are you there, sir? Hello, Mr. Uranta, are you there? Hello, Mr. Uranta.
Yes, please. I'm here. I'm here. Thank you so much indeed.
Right. Yeah.
Okay. Thank you so much indeed, colleagues, ladies and gentlemen. Thank you for the opportunity to be on this platform. I understand I have about 5 minutes, so I'll be running to make sure I don't overrun. But let me quickly say that in our channels Television, all our reporters are insured. So in the coverage of the pandemic and all of the actions therein, rest assured that everyone on our channel is adequately insured. But thank you for this opportunity to be on this platform. I like to talk journalism, especially to students of the media, and of course to practitioners in other fields. And at this time of the new normal, medical professionals have more than before become our allies, and we must work together to help navigate through the pandemic. The work of the journalist is to inform, educate, and then, of course, to entertain. I believe that the media is doing a lot to help report COVID-19. First, as you would remember, it was to explain what the virus was. because it was a novel virus, as the medical professionals will tell us, then how it is contracted, the prevention, and then advocacy to observe the protocol. And it is a continuous advocacy and a continuous process, I like to say. Now, the gradual emergence of the vaccines and all the information around it is receiving critical attention in the media. I'm just trying to paint the picture of how we have advanced from introduction to advocacy and then the observance of the protocols and where we are at the moment. You'll observe that the intensity or frequency of reports and coverage in the media has sort of dwindled. When, for example, in Nigeria, it was all high, you'd see every television station, every media house, had great programming and all of that to talk about this. Maybe because it was new and we needed to inform people and to educate them. Now, my take is that we must stay with the story and constantly explore all the angles there are for our audience, because the pandemic is not gone. So for those of us in the media who believe in this, it is a running story. So we must stay with that story. There are obviously stories that have been properly told or reported. Media practitioners must think deeper to see good and new angles, through which to tell the story. For example, as someone mentioned this earlier, but for example, there's not enough report on medical practitioners, the impact of being on the front line and the psychological effect of this on their family and even their persons. We talk about the face masks and social distancing and all of that. What is happening in the head and the psyche of the medical professional? This is an important story we must tell. What goes through their minds? How are they able to breathe through this, knowing that they are the most vulnerable as a result of exposure? So a story such as A Day with a Frontliner, a doctor, is a good one. How does an orphan occasioned by COVID-19 survive? And if he's a student, how does he cope with school when it resumes? Can we identify such people and do a piece around them?
All right.
There hasn't been a conscious effort from medical personnel on why Africa doesn't have all the infections. So reporters and journalists must work with medical professionals that will put this to the fore. And who knows, that may be an opportunity that is sparking the untold story.
Thank you so much, sir. That's the AGM training, corporate communications, and of course operations of Channel, the multi-award Channels Television in Lagos. Okay, now we will, in the course of it, we'll also hear from one of the medicals in the US. I understand a lot of journalists have joined us. I can see BC has joined us from the UK. Joy has also joined us from the US. But now we want to call on Professor Olumiwa Odusonia. He's a professor of public health and, of course, the director of research and innovation at Lagos State University. So I want to believe you are on. You just talk to us, journalists, on those areas we have overflogged, and of course the areas you feel that we have neglected, some areas that that have not been known. But don't forget, before you go on, so don't forget, for those that have joined us, this is an event put together by the Southern Examiner. Southern Examiner is a virtual news, is a virtual paper in the US. So please, and of course supported by a lot of media houses and of course the departments of mass communication in some universities. Now, Professor Odusonia, we want to listen to your presentation on the areas that you feel that journalists have neglected, have overflogged, and of course they need to pay proper attention to it. Professor Odusonia, are you there?
Yeah, good evening, everyone. I want to greet everybody, the earlier speakers, and the convener, Dr. Alpan, who approached us. So we are speaking from the perspective of being medical people, public health experts, and our department, Department of Community Health and Primary Health Care at the Lagos State University College of Medicine. And we have another colleague, my friend, Dr. Lero Robert, who is also from our department at the University of Lagos. I would like to share my screen and talk about the issues before us. Some of the journalists, you need to enable me to share my screen, Dr. Samuel.
Okay. Okay. The admin, please, can you enable Professor Odosonia, Dr. Adeniran, and then Dr. Roberts? These are the two public health consultants that would share their screen. Please, can you enable that? Is it enable, the admin?
This is only host can share. While they get us to be able to share a screen, we want to thank you again. My first comment while they're getting that is that the media is very important in informing the world. And like Dr. Akban had said, whether it's traditional or new media, the only way we know what happens is by information, particularly information that is outside your house, whether it's for traffic, whether it's for security, whether it's for health. And in our villages where the town crier, or we spread it by word of mouth until somebody is a rumor carrier. These are all sorts of information, but we have progressed to where we have the media that we can then use to speak. And the key about areas or gaps in COVID-19 reporting is that, one, correct information is key to promoting behavior change. COVID-19 is a long-term disease. We're talking about now chronic COVID cases. It's not just an acute infection. And so correct information, behavior change and behavior change communication is practically important and is the key. No single intervention is going to put us over the line. We must also realize that the media, there is plenty of fake news, unverified information. And that's also important to know. And then we then need to know that the underreporting is also there. Everybody knows about the coronavirus. Now we don't need to worry so much. We all know how the virus looks like. Recent data is that we have about 55 million cases globally and about 1.3 million deaths. The US has crossed over 250,000 deaths. In Nigeria, we're talking about 65, almost 66,000 cases, 65,839 as at 19 November, with 1,165 deaths and 61,503 cases have recovered. In terms of gaps to reporting, I still can't share the screen. I think I need to work on that. There are 4 areas of gaps that I would want us to note for this presentation. Number 1 is environmental issues. Environmental issues, and I would explain that. Number 2, issues around the pandemic itself, the pandemic trajectory. Third area that we need to report that have been not covered well, secondary effects of the virus and the pandemic, and number 4, response to the virus. The earlier speakers, the mass comm, the gurus have alluded to one of these areas. What are the issues of environmental factors? For example, the demographics. Who gets COVID? Who does not get it? And somebody alluded to the fact that why is Africa not getting as much infections as projected? People have attributed to prayers, luck, and all of that. But the key issue is that Africa has a young population. The other places like Italy and have a high level numbers of old people who have impaired health, but are able to survive and have high quality of life because of the good health system. When those people therefore come into contact with COVID, they die more. It's like lighting a matchstick in a room where you have a lot of petrol vapors. That's what happened to the Western world. Two, perhaps the immune systems of people in Africa being young and having chronic challenges by parasitic and infectious disease is probably able to respond faster than elsewhere. Three, population density. A lot of places, India is a place where you have a lot of high population density. India, big cities, Delhi, Kolkata, and even in Brazil. And you find that the places in Italy that had those problems were also places that people lived in communal settings. Then the issues of air pollution, very key, will be important in a place like India. And then seasonal and climatic change. Many countries, US, UK, are in second wave because, again, we know that viral infections tend to thrive more in the cold seasons. Maybe Africa, again, started in our warm season, so it wasn't as dense. So those are environmental factors that we need to report more. Second area is pandemic trajectory. Issues about who is dying, what's the actual mortality rate, issues about standards of testing. When we have cases, they are not tested by the same methods. There's a huge lot of differences, but each country has assigned to itself how it defines its COVID case. Is it by antibody testing, antigen testing, or by RPC testing? Who is dying more? Issues about the role of asymptomatic cases, issues of immunity, issues about adherence to containment measures. If you go all over Lagos now, only small numbers of people are wearing masks. Those are issues. Why is it? And then do people even believe that there is COVID? That's been a big problem. And how do you balance lockdowns like they are doing in the UK now? Spain has done its own, Israel has done its own. Issues of livelihood. Those are areas that people need. Why do people not? In fact, in Nigeria, some people thought COVID was a scourge for the rich, and that the poor were immune. One area that I believe we need to talk about and cover clearly are areas of secondary impact. For example, homes that had challenges before lockdown, as everybody was not locked down, so there's a rise in domestic violence, domestic and rape, and sexual abuse. Those areas are not well covered. Mental health issues including journalists as well, of health workers. Many people have committed suicide. Issues about primary care utilization, food security. You can imagine locking down a Nigerian community where people did not go to farm. There are issues there. Interruptions in supply chains, people couldn't travel, you couldn't get PPE shortages. Issues about malnutrition, issues about schooling. The universities are locked down. Secondary school and lower schools just only resumed about 2 months ago in Nigeria. And then the issues about interruptions to humanitarian programming, everybody ran away, embassies closed, aid workers left. Those are areas that have not been covered. And then the fourth area is the issue of response. Somebody had mentioned about budgeting, issues about donor planning and funding, transparency, issues about humanitarian data, issues about implementation, success of containment measures. So I would then talk about vaccines, because that's what is the breaking news in COVID-19 now. There are 3 stages in the course of infection or life cycle of COVID-19. One is the issue of exposure. If you have not been exposed, you can't get COVID-19. It's airborne, so people have to be exposed. When everybody that is exposed gets infected, that's the second stage. You can have an infection. We say in public health that the presence of a communicable disease agent is necessary but not sufficient to establish a disease. So infection and the third disease. So many more people will be exposed. We will all go enter vehicles, go to churches, go to closed places. A smaller number will get infected, and a smaller number will then become infected. Talking about immunity, the body immunity is anchored on the white blood cells in human beings. And there are two groups, those that produce circulating antibodies, which we call the beta cells, and those that produce immunity in the body itself, in places like the spleen, the thymus, the T cells, which help us to produce what we call long-term immunity. And the duration of immunity in COVID-19 is not known. What we have seen is that the number of people are beginning to have second infections, the same people. That means that the immunity is diminishing. Now, what's likely to have a major impact, dramatic impact, I think three things are important. The issue of physical distancing, not social distancing anymore, or lockdowns, if you manage it very well. Two, issues of face masks to prevent exposure, reduce exposure. And three, vaccines. Vaccines are cost-effective public health measures. We know that all over the world, whether it's for against tuberculosis or measles or the seasonal flu. But the vaccines will not solve the COVID-19 issues. The vaccines will now need to have 2 doses. We have 3 vaccines that are ready for public health entry use. There are all kinds of ways we deliver vaccines. The 2 leading ones now, 3 vaccines I've been talking about. There is the Pfizer vaccine, which has reported a 90% effectiveness rate. It's a messenger RNA vaccine in which they take the COVID virus, take the RNA of the virus, put it into people, and the body then produces that virus, virus spike, and then antibodies are produced against it. Then there's the Moderna virus, again, where vaccine, also same efficacy. The challenge with the Pfizer virus is that it requires about storage problems, -1.5 degrees. The Moderna is about -20, but the Oxford vaccine with AstraZeneca is probably the vaccine that we may see work well because it doesn't have a lot of storage issues. None of them has been approved, although the Pfizer vaccine has applied for emergency use in the US as of yesterday. The issues with vaccine in this matter will be the problem of cost and affordability and equity. I'll close by mentioning what should the media be doing for us. 1, they should fact-check vaccine controversies, since that's going to be the next stage. They should also advocate for equity and similarity in vaccination, so that all of the vaccines do not go to the West. UK has ordered several tons of vaccines, so have many other countries. North African country, maybe South Africa may be the only one to get because they were part of the Oxford trial. Health workers and elderly groups will be the top priority. It's important, like we're doing today, for the media to invite experts to speak on vaccines and other areas. We also need to promote other interventions, especially face masks. We should encourage people to be responsible. And I also believe that the media should also be looking at secondary issues, not just secondary effects, not just only the hardcore medical issues, of mental issues about coverage, issues about compliance, not just the hardcore medical issues. I would like to stop here and thank you for your attention. I'm done. Thank you.
Thank you so much, Professor Olumiwa Odusonia, the well-published professor of public health, of course, in Nigeria. Thank you so much. And now I will bring in the HOD of community health, LASUTH, and then immediately after that, Joy Kish would come and just share about 2 minutes experience of COVID-19 with us. I'm talking about her experience in the US, working with the US Army laboratory and testing effect. I want to believe that Dr. Adeniran is there. Dr. Adeyinka Adeniran is the acting HOD of community health, LASUTH. So are you there?
Yes, I'm here.
Hello.
Good evening.
Oh, Dr. Adeniran, welcome. Good evening, sir. God bless you. Please, we want you to talk to us on those areas that have been overflogged, and of course, the areas that have not been covered yet. You know, for example, one of my colleague friends just talked about the issue that the media have not done a lot in the area of enlightening the public that COVID-19 is not an abominable disease. So what are those areas that you feel that as a medical practitioner, as a medical expert, especially public health expert, that you feel that the media have not done enough to reveal this area of the pandemic? You have the floor,
All right,
sir.
thank you. Yeah, thank you so much, Dr. Wana. And good afternoon, everyone. I want to appreciate all the professors in the house, and I also acknowledge the father in our father in the department, Professor Olumuyiwa Odusoya. I also acknowledge some of the members of our department, all the consultants and the registrars in our department. I can see some of them on the platform. So thank you so much, everyone, for joining. Okay, so I'm not going to take our time, and I'm not going to repeat some of the things that Professor Odusoya has mentioned. So I just want to talk about 5 areas that I think we need to look at moving forward. The first one is talking about lessons learned and changes being made by the authorities. You know, COVID-19 came in, the pandemic came in, and exposed a lot of rots and a lot of problems in our health systems, to the extent that some of the public officials that are in charge of the response were so surprised about the state of things, talking about our health systems. And the question I'm asking myself is that, are we taking those lessons? I mean, what are the changes that we're going to make moving forward? So it's not just to cry over, I mean, the state of things, but what lessons have we learned? I think the media also has a role to play in this regard. Okay, so talking about what lessons have we learned, what are the changes that we need to make to strengthen our system and moving forward? Is it in terms of, I'm going to talk about vaccines a bit. Of course, Prof talked about it, but I'm also going to mention 1 or 2 things about it. And then you're talking about the second wave. That's the second thing I think we should also look at. There are a lot of issues, I mean, a lot of conversation around the second wave. And the question we need to ask ourselves is that, is there any evidence to this second wave rumor? I don't want to call it rumor, or the conversation that we're having around the second wave. Because before you can talk about the second wave, we have to look at the positivity rate. We have to look at the number of testing that we are doing. And as we all know, that we are still lagging behind when it comes to testing. Okay, from the report that I got from the NCDC, that's as at yesterday, with a total number of 128 tests. That's 728,000 tests. Okay, and then we are doing about between 3,000 and 4,000 tests on a daily basis. Even though we have a capacity to do about 15,000 tests daily, we are still not, close to that at all. And then if we compare ourselves to our junior brother, South Africa, I mean, based on the report that was released recently, that we are the biggest economy in Africa, followed by South Africa. And South Africa has done more than 5 million tests already. And they are doing more than 20,000 tests on a daily basis. Of course, they're going to discover more than we do. And so if we look at that, I think those are, I know we are talking a lot about that, but what exactly are we doing to correct this? And I know there are a lot of things responsible for this. There is what we call active case search, where we're supposed to be searching for the contacts and testing them to see whether they have the virus or not. And that has stopped for a while now. Of course, sometimes ago, the Lagos state government started thinking about coming back to this, but we know that that is going to affect the rate at which you are getting people, because what we are doing currently is for people to report themselves to come and test. Even for people that have to test compulsorily, the last time in the media they said that some people paid for testing, but they never reported to get tested, and then they are coming into the country. So these are some of the issues that I think we still have to look at. We also look at the issue of risk communication, okay? Because if we do not get our communication right, and people will not be able to take the right actions that they're supposed to take. So we need to look at how are we communicating our messages to people? Are they getting what the exact message that we want them to get? Because there's a lot of apathy. We know that. I mean, Prof just mentioned that most people are not using their face masks. They are not responding to, they are not following all the guidelines that have been provided. So there is a lot of apathy. Even if we say people should go and test, even for people that are paid to get tested, they are paid. They didn't even show up to get tested. So these are some of the things I think we have to look at. And then, of course, Prof also talked about confidence. You know, people have to look at confidence. And how do you build confidence? There must be evidence. You have to give people evidence why they have to trust what you are doing. Okay. So I think another issue. Okay, I know. Okay, I thought yes, I have 10 minutes.
Okay, you to that because we are rushing. Thank God we are racing with time. The last presentation will be from Dr. Alero Roberts. Dr. Alero Roberts, are you there?
Yes, I'm here. Thank you very much.
Great. Oh, great. Dr.
I gather
Alero,
we're not able to.
No. We are going to have you. So you listen to this take from the US so that you can wrap it up with that. And I want to believe Joy Kish is on the line right now. Joy, are you there?
Yes, I'm here.
Okay. Joy is of course works with the U.S. Army. That's Walter Reed Army Institute of Research. They carry out research studies on disease affecting the U.S. Army, men and women overseas. That's viral disease branch of it, and she's in charge of documenting and lab data and laboratory procedures. And of course, she's a technical writer stroke documentation specialist with the U.S. Army Laboratory. So, Joy, can you just briefly, maybe in just 2 minutes, tell us your experience, outside in the U.S. and of course, what happens, especially like your department is in charge of these viral diseases affecting the U.S. Army men and women overseas.
Yes, thank you very much. It's an honor to be here, and it's an honor to, also bring more light on this issue. So I work as a technical writer in the compliance unit. So my responsibilities include making sure that all of the lab procedures and research are FDA compliant, or compliant by the Food and Drug Administration over here. So right now we're still doing a lot of research on viral diseases. Every day we're learning more about everything, and our main priority is serving and protecting the men and women of the U.S. military. So when President Trump had COVID, he was hospitalized at Walter Reed, and my colleagues treated him, and he was there were emergency use authorization drugs that he was able to use. So we're still doing a lot of research and testing and seeing what drugs actually can help someone to manage this disease. So it's something that I don't have the answer to. I don't have the answer to what can be done, but we're still doing a lot of research every single day about how someone can be treated, how symptoms can be managed. So Yeah.
Okay, so how is it for you guys over in the US? I'm talking about the common man, and of course the US military. Are they jittery? Are they scared? You know, they always say that the US Army is one of the most powerful in the world.
So over here, we still have a lot of restrictions on, you know, where people can go. We still have, you know, some states have a stay-at-home order in place. Restrictions on, you know, social gatherings are definitely still in place. Right now, a lot of the workforce is working from home, you know, like for those in the office, it's mostly for like, you know, a lot of serious issues. So a lot of us, like myself, are, you know, working from home, you know, trying to limit social gatherings or even any kind of gathering. So a lot of us are, you know, at home and, you know, working from there.
All right. Thank you so much, Joy. Of course, let's move to Dr. Ann Alero. Dr. Ann Alero Robert is a consultant of public health in Lagos University, a teaching hospital. I'm talking about the College of Medicine, University of Lagos, LASUTH. Dr. Robert, are you there?
Yes, I am. How are you?
Yeah, you know, thank you so much. You know how some of us fear statistics. I'm talking about figures. So can you tell us those things? I'm talking about journalists now. Some of us don't want to look at those figures you medical doctors put out there. So can you kind of friendly tell us, you know, those areas that we have overflocked? It's still the same conversation anyway. Those areas that we have overflocked as journalists and of course as teachers of journalism, and of course those areas that you feel that there is a gap, like Professor Odusonia said, and that we need to look at. And of course, like Mr. Ranta said, the AGM training channels, TV, that there's need to look at the psychological aspect of these frontline fighters. I'm talking about the medical doctors and what have you. So what have you discovered that you feel that if journalists should inject these into their reportage, I'm talking about scientifically, that it can help boost up their reportage?
Thank you very much for having me. And I think Professor Abigail Ogwezi-Disika had mentioned this. There are the one key major unreported area that I would speak to would be the mental health and mental stress that health workers are going through. And this is not just doctors, nurses, and physiotherapists. We've got all the other cadres of healthcare workers who feel that they're being overlooked, whose voices are not being brought to the fore. Now, another interesting thing that has come out in all of this is everybody is agreed that the man on the street seems to be in doubt as to the seriousness of this disease in Nigeria, probably because our numbers are low, whether due to underreporting, whether due to under-testing, whatever the reason may be. We haven't quite gotten a handle on it, but people are getting a little COVID weary. Already they had a fear of going to health facilities. Already they had a lack of trust in anything government, and already there were huge needs of daily subsistence workers. So I think one of the major areas that's been unreported is bringing those grassroots voices to the dialogue table so that we can understand better. And in fact, Dr. Sani Aliyu mentioned it at a conference we were at just 2 days ago, when he did agree that the NCDC had overlooked in the beginning, they have since rectified their error, had overlooked in the beginning the importance of the risk communication and the community dialogue and community participation. We need to understand the psyche of the man on the street, the majority of the population. There's no point just us sitting here. We're only addressing the 1% of the 1% of the educational elite. I do not know how we are saying that we have an emergency operations response to this pandemic with a major chunk of the human resources of this nation out of work. The universities have been out since the 22nd of February. So we have not had the full benefit of all the scientists, the social scientists, the psychologists, the scientists who actually do the research, not us, the practitioners. More often than not, we simply put into practice what the scientists have discovered can work. And without this crucial group of human resource, Nigerian human resources at work, this is where we are. So one of the things that I hope will come out of this is the increase in investigative journalism to follow the money. Track every cent, because it's not enough to know how much was allocated. We want to know how much was spent, what it was spent on, and the impact those funds had on the collective good of on the collective health status of the Nigerian people.
All right. Thank you so much, Dr. Alero Robert. I want to believe that some of my journalist friends have listened to this. I see a lot of them hooked on from several media houses, especially morning show anchors. I've seen a lot of them, Abigail Azaya. Of course, we also have BC Adeshino, a freelance journalist in the UK. And of course, I can also cite the husband too. And then we also have Choma from the BBC. Choma, are you there? Before Choma comes up to tell us the experience in the BBC, that I'm talking about the British Broadcasting Corporation, we will leave the floor for any resident doctor, be the registrar, a senior registrar, or a consultant that might want to add one or two things to the conversation today. Now, Choma Obirinwa, are you there? Hello, Choma, are you there? Okay, while we are waiting for Choma, I want to call on BC Adeshino. Hello, Choma, are you there?
Hello. Yes, I'm here.
Oh, okay. Please, can you share with us? Yes, can you share us your experience with the BBC? I'm talking about the unreported areas of COVID-19. Yeah, I can hear you. We can hear you. Can you hear us?
Yes.
Okay. So, how is it for you over there at the BBC?
Okay. First of all, I'd like to say that we have stayed with the story. Let me borrow the words of Dr. Ranta, as the AGM Channel Television, who stayed with the story. The BBC has comprehensively, covered COVID-19 and all, the impacts, the effects, that has come with it, and it's still coming with it, going from patients to the medical practitioners, those at the frontliners. In fact, we tell individual stories. We go to the extent of nature. For instance, we tell the story of a doctor who, was mentioned earlier in this meeting, has the psychological impact, how he or she has to face their family, despite the fact that, they're just coming from the hospital. We've gone an extra mile when it comes to, telling the story surrounding COVID-19. However, in Nigeria, the intensity dropped. The intensity did not drop because of anything that is unusual, but the fact that we have a challenge in our hands. And, that's one of the reasons I joined, this prestigious gathering. I want to understand why most Nigerians do not even believe that the virus exists, because that is a challenge that the BBC in Nigeria is going through. Sometimes you put out a story out there to say, okay, this man, lost 2 people owing to the virus, or this village or this community because they didn't have running water and all of that. You try to paint the picture for them to understand that this actually is ravaging, in some parts of the country, and this is the age range and all of that. Trying to bring all this information to them, and still they throw it back at us, say we are just telling cock and bull stories. Okay. So it's challenging how to convince.
I can imagine your pain. I can feel your pains. You understand? That's one of the reasons we convene this meeting, so that we can have we can put our heads together as as journalists. I'm talking about media professionals and of course medical professionals too. I want to acknowledge the presence of Professor Ogun. I understand he's the professor of medicine in Lagos State University Teaching Hospital. Professor Ogun, are you there? Do you have anything to say to the journalist? Hello, Professor Ogun, are you there?
Yeah, well, thank you very much, sir. Well, I think it's been a very exciting session, and I really enjoyed joining this session. Yes, I would just encourage that we should continue to do health education, the public health education for the masses. COVID is real, no question about that. And of course, even with the number of tests we're doing for now, we know the number of cases we have admitted have been on the increase. And there's certainly a second surge, which we're actually seeing as well. So we need to ensure that we continue to use our PPE, wear our face mask, and maintain social distancing and physical distancing as much as possible. So thank you very much, sir.
All right, thank you so much, Professor Ogun. Now, I want to call in BC Adeshino. BC Adeshino is joining us from the UK. BC, are you there?
Yes, good evening, everyone.
Yeah, good to see you, BC.
Good evening.
Yeah. So what has been your experience in the UK with the COVID-19 reportage and all of that?
Okay, before I think I have someone who is in a better position to talk to everyone about this. And that happens to be Idris Adeshino, who is the
Mr. Idris,
editor-in-chief of Alternative Africa, a UK-based online media website that focuses on Africa and every information that relates to Africa.
Okay.
So if Idris Adeshino is listening, I would like him to come on board and talk about his experience about COVID-19 and reporting. I guess he's somewhere there, so he'll be coming up.
Okay.
Thank you very much.
If you are there, please come up. We just give you like 2 minutes to give us that experience in the UK so that we open the floor for the APHN and, of course, resident doctors and consultant of public health to also give us their take. So, Mr. Adeshino, can you give us your experience there in the UK?
Thank you very much. My name is Idris, and we manage a small website in UK called alternativeafrica.com. What we have done with Alternative Africa is track the trajectory of these issues across the continent. And with that, we're able to at least have a fact that we have 3 outstanding African countries that for now have taken the challenge ahead and are comparable to any part of the world. And we have South Africa, we have Egypt, and we have Morocco. Those 3 countries in Africa are outstanding. As we talk to you now, the 3 of them have done more than millions of tests. And although we have the cases in those are rising, we will tell you very vividly here that by December to January, Morocco, Egypt, and South Africa will be fascinating their citizens, their subjects with coronavirus. As I tell you now, Morocco, South Africa, and Egypt have ordered millions of this vaccination from different parts of the world, from China, from Europe, and by January, December, they will start vaccination. My worry in Nigeria and some Western countries is the fact that was raised by the BBC correspondent there. They don't believe this thing has happened. Again, what I want us to again look at in that context in this conference is the problem of faith.
Yes,
that's people true. Rush to churches, they run to mosque. They don't believe anything the scientists say. And that's my worry. We need, as a people in that continent, to differentiate. In this part of the world, they have done that. Churches have been closed, most have been closed. Nobody has raised an eyebrow. But in Nigeria, we see pastors and imams shouting. No, we need to let Nigerians know that there's difference between faith and sciences. We need to know we two cross and why they stop. Again, our media must prioritize education. I've not seen that in African media. Education. They need to do that. Thank you very much.
Thank you so much, Mr. Adeshino. I also want to acknowledge Dr. Bakare, and of course, quite a good number, not a few now, a number of consultants that are present in the house. I'm talking about Dr. Bakare, and a lot of them from LASUTH, and of course, their resident doctors that are present in the house. Now we want to open the floor for journalists to ask questions. And please, you can unmute yourself. You can open the mic. Just look at that. Mic button, that red mic button, and then tap it. Then you would unmute yourself. Then from there you'll be able to, ask your question and of course contribute to the conversation today. Do we have anyone that wants to ask any question? Do you have any question for Dr. Alero, Robert or Professor Odusonia or Dr. Adeniran? Or do you want to ask Mr. Idris Adesina any question concerning how this reportage is done in the UK?
Maybe I need to ask question first from,
okay.
My name is Idris Adesina anyway. I need to ask question from Dr. Professor Olumuyiwa. He spoke about behavioral change. And as a journalist and as a registered PR practitioner in the United Kingdom, I am much concerned. I'm very much interested in that aspect. How do we carry out this behavioral change? How do we report a behavioral change? Deploy media to manage attitude, to change attitude in the face of die-hard, two people who do not believe what you are saying, and two people without income. Somebody talked about having to shut down the country. Livelihood. In UK, they provide livelihood. In South Africa, they did that. In US, they did that. In Morocco, in Egypt, they've done that. I don't know how much has been done in Nigeria and some other African countries. We saw the COVID materials that were stored by the governors that were being looted. So how do we affect this right with your reportage in the face of these challenges?
Professor Odusonia, are you there? Professor Olumiwa Odusonia, are you there? Did you listen to Mr. Idris' question?
I did listen to his question. For any disease, there is a hardcore science which does not bother the layman. And there is the effective messaging, which is what the man on the street wants to hear. What makes COVID terrible is that it's symptomatic in 80% of the people. Ebola was more dramatic. Some people will listen to you. Yellow fever is more dramatic. COVID is like common cold. How does it differentiate from malaria to avoid the COVID test? I think we focus too much on the science and rather than getting people to believe in our story. And the initial reportage was the big men that had it. And it came through in Nigeria through an expatriate. Then it was mainly Ikoyi, Lekki, Axis. So the man on the street didn't believe it. And testing wasn't available. And people were running away. So we missed the boat at the beginning. And I'm not sure we can fully recover. Two, COVID, like Raniro said, also exposed our not only weak health structure, it also exposed our very bad inequity in the country, where there is a widening gap between those who are very fortunate to be wealthy and those who are not, such that for most people, once they cannot earn an income on a daily basis, they're in trouble. The UK provided cover for a lot of their citizens, up to 20% of salaries. Nigeria did not do that. We just asked people to shut down, and people did for the first few days. You found that people who walked great distances just to go to their shops so they can make a living. So I think one thing that the country must do is to look at how to build a workable, more equitable society. Until we do that, COVID messages won't sell, because once livelihood is affected, every other thing is gone. And people change again. We ask people to wash hands. Where is the water? We say sanitizer. Somebody who has not earned an income will pay 500 naira or 1,000 naira. Face mask were very expensive at the beginning. So I believe the way to change, because COVID is not going to go in a long way, is to make sure we change things and use it to rebuild a society. And then the journalists to have, like I mentioned, there's a bit of the social aspect, secondary aspect that journalists must, they may not worry too much about the science, all that will come into the medical profession and our journals. But what's happening to people? How are they coping? Is there violence? How are they living? If you bring those stories to the fore, people will believe that there is a face and empathy to COVID. Thank you very much.
All right, Mr. Adesina, I want to believe that.
Can I have a contribution?
Please go on, Mr. Ranta. I want to believe that, Mr.
Yes,
Ranta.
I wanted, yes, please. I wanted to mention that one of the most effective ways, in my view, the media can also employ in trying to bring the COVID issue to the fore is by the use of testimonials, survivors. Because I tell you, not so many people believe that this virus is real. So if you see more of people, exists. If you see more of people who have gone through this experience, coming out to talk about their experiences and how they survived and the symptoms they had to go through, chances are that people can relate with that. So survivor's story is very important. Another thing for me would be the use of grassroots formats, of communication to get to the people. I tell you, if you go to the rural areas, people don't believe this exists. I was in a taxi in Port Harcourt going to my village, and I asked the taxi driver to please wear your face mask because I was wearing mine. And he said, "What are you talking about? That there's nothing like coronavirus, that I should, all you people who come from Lagos are the ones talking about this." So I think that the rural areas, communities need to be drastically addressed in such a way that they come to appreciate that this is quite real. So to avoid community spread, because I believe this is all there and nobody cares.
Okay, thank you so much. But before I go on to call on Dr. Olufulayo, she's the chair of APHPN. Would love to acknowledge the presence of Dr. Babatunde Odukbemi. He's a consultant with LASUTH, Dr. Modukbe Akinyinka, Dr. Bakare Omowumi, Dr. Tolu Olufukayo, Dr. Eo Odekmami, and then Dr. Oluwashen Odusonia, and others. These are consultants with LASUTH. And of course, for senior registrars, Dr. Anifo Woshe, Dr. Emechebe, Dr. Oshodi, Dr. Samuel, Dr. Ogundimu, Dr. Adeyemi, Dr. Odekmami, Dr. Durojaye, and of course, a host of others. That's for senior registrars. And of course, for registrars, Dr. Akinyemi, that's Tokbe Akinyemi, Dr. JJ, and of course, Dr. Adekbuju, and others. Please, I would like to call on Dr. Olufulayo to make a few comments on these unreported areas of COVID-19. She's the chair of APHPN. And of course, you will tell us what this acronym stands for. Please, are you there?
Okay. Good afternoon.
Good afternoon.
I greet the conveners and the presenters, and I thank you for the opportunity to just make a comment and commend you all for a job well done. APHPN actually stands for the Association of Public Health Physicians of Nigeria, which is an association of public health physicians, and we are involved in maintaining the health of our communities through largely preventive interventions. And so during the COVID-19 pandemic, for example, we have been at the forefront of the fight in so many ways. We've been involved in case search, surveillance. We've been involved in case management in some cases. We've been very big on risk communication and advocacy, as well as, community mobilization. So we've been involved in several ways. And so that's really how the association has, gotten its members involved. And quite a lot of our members are on this call right now at the moment. So it's been a, big opportunity for us to contribute and to work in several ways. And we're thankful that the pandemic has gone the way it has in our own country, in our climate, despite the way we have taken the COVID-19 preventive measures. We have been very fortunate you know, whatever the reasons might be, whatever you allude them to be, we have been very fortunate not for it not to have hit us anywhere near as hard as it had been predicted. But in going forward, we must make sure that we improve on our response. And some of these things have been touched on today in this meeting. I think I'll probably stop there for now, unless there are any specific questions. Thank you very much.
All right, thank you so much. And at this point, I don't know, is there any consultant that might want, maybe in the course of your research, you have something that none of the presenters today didn't really touch that could be of a good, that could be of importance to the journalists, and of course, some of us are journalism teachers. I'm talking about any consultant from LASUTH or the APHPN. Okay, and then maybe from the senior registrars, any contribution, anything you found out that can be of immense benefit to the journalists in the course of their duty, so that you can use that to improve their reportage. Senior registrars or registrars? And of course,
sorry, let me quickly ask one question, a general question, if I may be permitted.
Please do.
And let me ask about one area I've developed interest that I've not found an answer to. We have tried to call it CDC, that's African Center for Development Disease Control. They've tried to, the WHO Africa put up a committee to find out if there's an African angle to these vaccines. That's a low research. That's a, to this research. I want to find out exactly if there could be, because we all run to US, run to UK, run to everywhere now to look. We all really look thin. The GAVID community, African has plugged themselves into GAVID now. They want to buy vaccine. Is there a way? Is it possible that an African angle to this, in terms of local medicine, natural medicine, alternative medicine into? Because I know WHO set a committee. We've tried an answer from the African cities. Up to now, we've not got an answer. Is there anybody amongst our consultants here who have had a bit of risk, the possibility of a local medicine, that is a alternative African medicine, into solving this COVID-19 as a cure or treatment?
All right, I will speak to it. I'm aware that there is some beginning research in Lagos University by a group of researchers in the Department of Biochemistry, Faculty of Science, to look at some potential indigenous African medicines, leaves and isolates, to see if they could help in COVID-19. The challenge with research about COVID-19, it also exposes very deep infrastructural problems, even in science and all that. The Nigerian Institute of Medical Research has been able to develop a testing panel, but it's not yet widely used in the country. Whereas IPD, Institute of Pasteur in Dakar, has done a lot, and they have, Senegal is a country that's also doing very well. And it takes years of investments in the health, welfare, and education sector, which our country has not dealt with. How can universities be on strike for 8 months in the pandemic over payment structure? And we're not saying we agree. That's a lot of problem. I mean, how long does it take to build a world-class research laboratory? I've done vaccine. I do a lot of vaccine trials in Nigeria. Where is the lab to isolate the virus and get virus particles in this country? You need a BSL-3, BSL-4. And those are some of the issues. So even Madagascar, that brought COVID-19, it was a mixture that they didn't test. And the medical doctors in Madagascar told the president, the man said no, he didn't believe in them, it was working, they were showing it everywhere. Madagascar now had to ask to help them solve COVID problem. In fact, Nigeria did more work on that medicine, on that their preparation, than Madagascar. I told her it was basically artemisinin that was in it.
Yeah.
I mean, They should have done basic work. There are enough people. I think the problem is that our political leaders despise scientists all over Africa. That's just the truth. I mean, it's only South Africa that got into the Oxford vaccine trial. Brazil did, Mexico did. They have large vaccine manufacturers. Those things were not developed by angels. We must challenge the government, and that's where the media comes in, to put money. I'm talking about the palliatives. How can you stop palliatives and be telling us stories about which was preparing for a second wave? And now, I mean, we are not going to talk about the issues about people who protested, but those are signs that we need to rejig the African society. Thank you.
Thank you so much. Mr. Adesina, I don't know whether that's satisfied your curiosity.
Yeah, because it's an area I'm very much interested in, because look, we just collect from the world. We have no contribution to this thing, and that worries me. And that's why I'm so interested in that aspect of it. And that's
and somebody just talked about, I think Dr. Tokwe Durojai just talked about the issue of data collection and protection. And I don't know whether any consultants, okay, maybe let me just put that across to Dr. Alero Roberts. Dr. Roberts, if you can hear me, one of the senior registrars in the house is asking the question about privacy in data collection and, of course, protection. How can we be able, I'm talking about medical data, how can we, use this data, especially as journalists, to generate and, of course, produce programs for the listening and, of course, viewing public?
Thank you very much. And Professor Odusoya, God bless you, sir, for saying it very politely. I was about to answer, but I certainly would not have been as polite as Professor Odusoya. The issue about data protection, privacy, and the use of big data, there's no point reinventing the wheel. And Professor Odusoya has said, if only we had our scientists in their laboratories and in their offices, we have enough academic expertise to handle big data and to be able to make projections based on the data that we are generating. But what we are having now in Nigeria, in this COVID situation, is just a few committed lecturers who are working, despite the fact that they haven't been paid, in assisting the NCDC to collect and collect this data and use it to do mathematical models and trends. There's been a lot of work being done, but this amount of work is still being done by very few people, and therefore there's only so much progress and traction that we can make in regards to this. But there are standard protocols for data protection and standard protocols for data privacy. We don't need to invent the wheel. What we use is anonymized data. So we have X number of patients who have suffered, who are in this age range or in that age range, or presented with this or that or the other. We don't need to know their names or where they live. We just need to be able to manage this data. But it's a science. And we haven't had the scientists at work since February 22nd. Can somebody please speak to that?
It's okay, ma'am. All right, ma'am, let me ask you a question then. I used to work with Radio Nigeria before I left and joined the classroom. If you had come to Radio Nigeria, as a producer, as a presenter, and maybe the controller asked you to package a program, look for an area about COVID-19 and package a program, out there on Radio Nigeria's network, what area of COVID-19 would you package? Maybe like a 10 minutes program?
It's very easy. Voices from the grassroots. That's what I would have called it. And it would have been the testimonials, it would have been the FGDs, the focus group discussions, and the in-depth interviews with people at the grassroots to understand what they believe, why they believe what they believe, and what the determinants are, so that we could better craft a message that would resonate with them. Now, as all of you in the media will tell us, this is not a one-size-fits-all. So what will be crafted to fit a community in, say, Ekiti State will not necessarily resonate with the residents of, say, Akwa Ibom.
That's true.
Or in the north. So we would call it voices from the grassroots. And what we would do, what I would do, was go right down to the grassroots, right down to the people who are affected or who are not affected, quote and unquote, who feel they're not affected and therefore it doesn't, and find out exactly where their pain points are and bring that to the dialogue table so that we could better craft the message.
All right. Thank you so much, ma'am. Now, I want to leave the floor for the journalists. You have questions to ask, because I know from henceforth, a lot of journalists will begin to change their narrative and, of course, dimension in the area of their reportage and, of course, production. Do you have any question that you might want to put across to the any of the consultant, any of the professors of public health in the house today, that maybe something that has been worrying you? Is there anyone like that? Any journalists? I know they tell magazine crew, it's here, Radio Nigeria. A lot of Radio Nigeria journalists are also here. I can cite Maria Ihioma. She's the controller programs of Lagos Operations. That's Radio Nigeria, and a host of others. Is there anyone that I'm talking about, the journalists that might want to ask any question? Anyone like that? Hello, did you hear my question? Did you hear my contribution? Did you hear me? I want to believe that the journalists are not media shy now. They are not microphone shy now. Please talk. Say now.
I think what the media,
you forever
I think what the media needs at this time of the day, I don't know what they need in Nigeria. My need is having access to these resources, resource persons. Our access to them, I understand. I hope.
Okay, in terms of calling them for interviews, right?
Yes,
in terms of calling them for interviews,
that's very important for us. That's exactly what we are going to do,
because a lot of them ignore our calls.
The lady talks about the grateful voices.
Yeah, because a lot of them ignore, even when you send text messages to them to say, oh, I'm from this media house, I want to have maybe 5 minutes. At times they just don't. Maybe they just feel that, oh, maybe there's this 419 that is coming to, to play pranks with me.
Yeah, so maybe I need to speak to one issue like that bothers me as well here. That's the issue between the dichotomy of the local press and the international media. Our resource persons prefer to talk more to international media, and I might say something very clear here today. Well, I may be wrong, I may be right, but I'm not right. Every media organization has a specific goal what they go for. And from our experiences, from our interactions with them, from our past experiences with them, this international media, I don't think they can better tell our stories than ourselves.
That's true.
We have worked with them several times. They give you a set goal. My appeal is that they should accord us the same opportunity they accord international media. That when we call, they should please say yes to us. So, because there's no way we want to twist their story. No, we want to report things are done in Africa the way it is done. I want to report releases. I want to help the ordinary person understand that this thing will live long with us. In every part of the world are already telling that story, that we are going to, this is a new normal, that language now, the new normal. Nobody tells us to wear in UK, although we still have some recalcitrant people there, that's right. But nobody tells you when you get to the supermarket, you need to queue, you need to do this. So this is exactly the kind of, the professor talks about the second wave now and how we need to report that this thing is new normal. We have to live it. How we now to educate our people how to behave now. This is our constant behavior as we move ahead now, whether the vaccine comes or not, because we're already talking second infection. We have seen that around the world.
So
our ability to assess this resource person is what's critical. To me.
Yeah, I've seen a few hands. Mr. Idris, you raised something that I need to go and research. Maybe we'll just do a paper on that.
I'm okay.
Honestly, you are right, because most media houses most of our newsmakers would rather respond to Al Jazeera, CNN, BBC than taking a reporter's call from Radio Nigeria channels and the rest of them. I think this is one area
they are going to twist our story to follow their interest.
Yes, because they cannot tell our stories as we would properly tell this story. And of course, I see Dr. Robert and Mr. Ranta raising their hands up. And please, before then, let Professor Joseph Wilson is the HOD of Mass Communication, I think Ahmadu Bello University, Zaria. Dr. Roberts, you raise your hands, and after that, then Mr. Ranta would come up, and then after that, we throw the floor open, final floor for questions from the registrars, the senior registrars, the consultants, and of course the journalists, if they don't have anything to say or to contribute or questions to ask or to address us as journalists in better ways to, report this pandemic. Then we'll just call it a day. So please, Dr. Robert, you rest your hand.
Yes, I did, because as I think I see Dr. Tony Adeyemi on the call. She's the PRO for the APHPN Lagos chapter. There wasn't a single radio station, TV station, or newspaper journalist who approached the association for an interview. We were getting calls every single day, and Dr. Tony did a phenomenal job about reaching out across the board, across all the physicians in public sector, private sector, at the registrar level, at the consultant level, to get somebody who would speak to issues, as and when they arose. There were so many TV channels, and that's one thing that I must say that we were all very, very proud of, that the media, particularly in Lagos and nationally, reached out to the Association of Public Health Physicians for interpretation, for people to come and interpret policies, interpret the data, or interpret the trends that we were seeing. I'd hate to think that any one of us would rather speak to a foreign journalist than speak to a local journalist, because as a public health physician, it is our people that we are collectively interested in, whose health we are collectively interested in protecting.
Okay. Thank you so much. When I called you, you just pick ones. I can attest to that. But before Mr. Ranta comes up, somebody just sent in a question from, his name is Nathan from News Agency of Nigeria. He said it has been widely acknowledged that a stable immune system wards off COVID-19. Why is this crucial emphasis left out in the public communications message on the pandemic? Maybe I'll just ask you, Dr. Alero, why is this? It has been widely acknowledged that a stable immune system wards off COVID-19. Why is this crucial emphasis left out in the public communications messages on the pandemic?
The truth to tell is that you're right, but this is a function of education, of our educational system, rather than the fact that we're leaving out a crucial message. Everybody that should have gone through basic primary education should have this information about diet and nutrition. It's so sad that we're having to deal with this, but it also speaks to the reason why a great many of the population don't seem to understand the theories of disease causation and why they can attribute disease causation to the most fantastical conspiracy theories ever. But this is fundamental knowledge. It's like saying you don't know your times table and I should come on television to teach people the multiplication tables. This is basic knowledge, but we have to admit, like somebody has said earlier, that this disease has shown up major infrastructural gaps, not only in our health system, but more importantly in our educational system. So I apologize on behalf of all my colleagues for leaving out that basic piece of information. Of course, a stable, strong immune system helps the body fight disease.
We are not aware of this. Most of us are not aware of this. We are not being methodological in the production of such narrative. So
I know, because we all want to report Elizabeth Kafaru and her urine therapy instead. Forgive me.
It's well. All right, Dr. Alero. Okay, I'm here.
Dr. Samuel, if you remember, I mentioned that fact about immunity. Yeah. In fact, somebody mentioned that maybe the poverty better stimulated to deal with infections and things like COVID. But again, it goes back to, like Dr. Roberts has said, our education. Everybody should have what we call basic health literacy. We should be able to know how adequate diet and how your food helps you to become stronger, produce functionality in your body. And I mentioned in my presentation about the fact that we need the soldiers in our blood system, the white blood cells, to produce antibodies, to have what we call cells that will have long-term memory. We call them memory cells, which then can recognize infections that you have been exposed to. And that's the whole basis of all the vaccines we do. That's the basis why you give a mother tetanus so in pregnancy, so that the unborn child has some protection when he arrives on this planet. Thank you.
Yeah, Prof, you know what? You see, when we do our productions, program production, we bring it so low, so down to the fact that so that the common man they would understand, I just want to ask you, is there any kind of food, for example, if I go to produce any program on health, any health program, is there I need to tell my listeners or my viewers that kind of food, that kind of fruit, that kind of food that they can eat that can help boost up immunity? Is it? Some people believe that shower help to prevent cancer. Some people believe that pears help to boost up the man. The how do you call it? The sexual interest of the man. So, is there any form of food, any kind of food that we can eat that can help to boost up our immunity against COVID-19?
What I will say is balanced diet. There is no other story.
Okay,
and balanced diet means you are eating from the 6 classes of foods: adequate
protein, carbohydrate,
fat, and oil. And people should take up to 5 servings of fruits and vegetables each day. The other issue of one particular fruit is rich in this particular thing, you really cannot live on one alone. So if you are taking a cocktail of fruits from as simple as oranges to banana to guava to all kinds of vegetables, you will be healthy. Rather than to go and take, because again, if you overtake a particular, people can go and take plenty of vitamin C and end up damaging their kidneys. So they need to be aware. But if you take everything in it, the body has a way of
sorry for cutting you short, sir. Did you say
the cocktail to do?
Did you say excess of vitamin C damages the kidney?
Yes.
Oh my
yes.
God!
I you very easily.
Wow, it reminds me of Professor Temiye. I think told us came for a program and told us about them. For the first time in my life, I heard. I think Professor Temiye is in LASUTH. I think oncologist. Yes, he told us that children can also have. He said, yes, hypertension in children. I was amazed, and I'm just learning a new one today. And he also told us about the effects of comfort, on a child between I think 1 month and 6 months inside the cloth. So I want to believe our journalists. Okay, that's fine, sir.
If you expose a child to comfort, they can have the natal jaundice in the first 1 month of life.
I learned that from Professor Temiye. Yeah. Thank you, sir. And now, Mr. Ranta, after Mr. Ranta gives the final shot, we will reach out again to the consultants, LASUTH, registrars and senior registrars. I want to believe that they are not microphone shy or camera shy. And of course, I also want to reach out to some of our colleagues in the media too, to ask their question. Now, Mr. Ranta, are you there? You raised your hand initially.
Yes, I'm here.
Okay, sir.
Yes,
in case
please,
you don't know,
I'm
Mr.
here.
Ranta,
I just wanted to...
Okay, please go. I just wanted to introduce you earlier. Mr. Ranta is the AGM Corporate Communication Training and, of course, Operations Channels Television Lagos.
Thank you. I just wanted to say that before you can report on an issue, I'm actually talking to my colleagues in the media, that you must ensure you have a firm grip and knowledge of the subject matter. It's very important because that's the only way you can ask critical and intelligent questions. I'm sure that if you approach any professional and you're not prepared and you didn't do your groundwork, chances are that your questions will be watery and you wouldn't get all that you want for that story. And that is how you'll be gauged and measured in terms of intelligence and all of that. And so it's quite possible that most of I wouldn't say most of the professionals, some of them would prefer to speak to international media and not the local media, because they believe that the international media would have been thorough, would have done their research and all of that. But it's not in all cases. But what I'm saying, even when we teach when we speak to our trainees, is that you must do your research. You must understand COVID. You must understand all the necessary information around it so that you can ask intelligent questions. I'd like to thank Dr. Alero because she's been quite useful and she's always come to our station and other professionals. And I dare say that each time we knock on their doors, they've always opened up and they have spoken to us.
All right, thank you so much. I see somebody raising their hand now. Delia, I don't know what that stands for. Delia, you want to say something? You can unmute your microphone.
Delia is the short form of Cordelia.
Oh, that is the immediate past general manager of Metro FM, my former colleague, Cordelia Okbe. Cordelia, please welcome. It's an honor to have you. Welcome to the first doctors, medical professionals, and of course, media professionals.
Thank you for inviting me. Now, the question
Thank
I would
you.
like to ask for the vaccines, we've been hearing the US, for instance, they've been saying that, and some of those other countries, that hopefully they will be giving it to the citizens free. That is the plan. At least I still heard that today. I want to ask the seniors in the medical profession, do you think this can work in Nigeria? Do you think, I know you're not the government, but from your own perspective, do you think Nigerians can get the vaccine anytime soon when they're rolled out? And do you think they can ever get it for free?
Okay, I think we should direct that question to either Professor Odusonia or Dr. Alero or Dr. Adeniran. Any of them can answer. And I see Dr. Alero Roberts raising her hand up. Dr. Alero, do you want to answer the question?
Actually, I'm sorry, I forgot to lower it from the last time, but I'll be happy to answer because
Okay.
the issue of immunization is a very complex one. I know there's a committee that has been set up in the NCDC to address this issue of vaccine availability and then who is going to be rolled out to in order of priority. So healthcare workers and definitely those who are more vulnerable will be on the list first. As for free, that speaks to health economics. One of the things that is clear is that this is going to be it's a Gavi, it's on the list of Gavi funded vaccines, and therefore, those who are in the front line will definitely probably be receiving it for free. But free is relative. Free means somebody else is paying. You are not paying at the point of care, at the point of receiving it.
Oh, okay.
Then,
okay.
Like we're seeing with the test in Lagos State, it's a situation where if you want it for your as a personal preference in the private sector, you may very well be asked to pay for it, and rightly so. But if you need it and you are not in a position to afford it, then it's likely to be given to you free. However, I am not in any way holding brief for the COVAX committee that has been set up. These are some of the terms of reference that they'll be looking into as time goes on.
All right, ma'am.
I shall lower my hand now.
Okay, no problem. Please, just help to answer this question. I've seen journalists now raising their hands. Please, ma'am, why is it that they wanted to do the trial testing of the vaccines on Africa? Do you know the reason? Why not test it on the Caucasian? Why African? Is it that we have a better immunity or better trial kind of outcome than the Caucasian?
Okay.
I think, Professor Odusonya, do you remember that what the French scientist said? It was very...
Yes. Yeah, that's true. What I will say is that the old paradigm for clinical trials, for which I'm an expert, is to do it in single countries, but that has changed. We now do multi-country, multi-center trials. So, and science is data-driven. And so if we're going to register a drug in our country, in my country, then some of us will need to have participated that we can validate the evidence. So for example, the Pfizer vaccine has had 41,000 people all over the world. That's the kind of large-scale trials you want. So the French scientists were just talking from the wrong side of the mouth, basically. But South Africa, particularly in the Oxford trial, trials have been done in Brazil, trials have been done in Mexico, Russia has done its own trials, China has done its own trials. So there have been more, and trials have been done across Europe, across the US as well. So there's nothing wrong in doing trials in Africa, and because that would then help us look at the sources of data from Africa and see how the Africans will respond when they get the vaccine. So it's appropriate to include Africans in it.
Oh, okay. So
maybe,
I still
maybe,
see.
Sorry,
okay.
maybe I need to chip in that we also have trials in Kenya, we have in Morocco, and we have in Egypt.
Okay, thank you so much. I see Cordelia's hand still raised up. Cordelia, I don't know whether you are satisfied with that answer by Dr. Alero Roberts.
You know, just like Dr. Alero, I forgot to drop the hand. I'm
fine.
fine.
Okay, oh, it's okay. But are you fine with the answer?
No, it's fine. It's fine. Thank you.
It's okay. I've seen. Okay, thank you very much. Abigail Isaiah is also on the platform. She's a morning show. She's the host of a morning talk show. I think Last Giddy FM. Abigail, are you there?
Yes, I'm here. Good evening, Mr. Samuel.
Evening. Thank you.
Okay. Thank you very much for this concise lecture. I really appreciate this. Talking about the acceptance of people on the existence of COVID-19 in Nigeria, there's this question that people usually ask on the show, and sometimes I just reply them, telling them, okay, because we don't know the dosage, or because we can't prescribe, because we need doctor's prescription. People ask, okay, you say there's coronavirus in Nigeria and people are getting infected and treated. What are they using for the treatment? Why are they not telling it to people? If the doctors are overwhelmed with cases, why are they not giving out prescription to people? So
okay.
That's what
okay, that's one question, because we need to round off now, and then your question will be answered by one of the consultants, Ona Chukudi. Ona Chukudi was my student of journalism in Radio Nigeria Training School. I want to believe that he's also a practicing journalist now. Chukudi, are you there?
Yes, I'm there, Dr. Wana.
Okay, please, can we have your question? Yeah.
Yes, it is a question, but rather let me bring up one point that I found out. I think that this issue of unreported areas in COVID-19, I sense a conspiracy in the media. For one thing, the man from channels in Rwanda and Dr. Yinka, they themselves have highlighted some of the uncovered areas. Now my question is, what are we waiting for before we report these uncovered areas? Since these areas are there, and according to what Rwanda said later, that for we to report an issue, we need to have an informed knowledge, research very well. Now, does it mean that we don't have the information regarding COVID-19, that we in the media fail to report these areas to the public?
Okay,
thank you very much.
All right, thank you so much. Abigail was asking, the issue of dosage, COVID-19 and all of that. I think you got a question. Dr. Roberts, do you want to attempt the question?
It's very simply a case of clinical protocol. While patients are on admission for, and this is whether or not it's COVID or any other thing, not all treatment protocols are simply X number of tablets, Y times a day. Many of these, the medications that were being given were symptom-based. So, you needed to be able to titrate what is being given with while the patient is presenting. These are not things and because COVID is a new virus, none of this has been written down. So we've got to, it's not something you can just tell people, oh, go to the chemist and buy X, Y, Z and take it this way and that. There is still no cure for COVID. Let's remember that, please.
Okay, all right.
Many of these things still need hospital management, clinical management.
All right, thank you so much. Dr. Adeniran, please, I want you to respond to Chukwudi's question, and then from there, we take on Dr. Odegbemi and then we call it a day.
Sorry,
Dr. Adeniran, are you there?
I didn't get the question very well. The line was breaking.
Okay, so Chukwudi, can you ask your question so that Dr. Odegbemi would come in and give his final remark,
Yes,
and then we call it a day.
Okay, Dr. Inka, my question is this. You highlighted some of the uncovered areas of the COVID-19 and likewise Uranta. And these are media people. Now the question is, why did we fail to report these areas? Is it that we don't have the knowledge, the real facts, or why the delay in the reportage of these uncovered areas?
All right, thank you so much, Mr. Chukwudi, for that question. Of course, you have answered the question. You know, you don't report what you don't know. Okay, so and that's part of the reason why we're having this conversation, so that we can look at those gaps and then we can get help from people that have understanding, the professionals that have understanding about these things, and we can work together. And just like all the speakers have said, we all need to work together. I mean, some people will generate the evidence, some people will practice, and then some people will report as to, okay, what is working, what is not working. So that's the reason why we're having this conversation, so that we can learn and then know those areas and then report as appropriate.
Okay, thank you so much. I see someone, maybe this is the last one, and then Professor Olumiwa. Somebody raised his hand up. You are using Techno P904. Please, who is that? You raised your hand up. Okay, I'm saying for the last time, somebody raised his hand up. You are using Techno P904. You want to make a contribution or a question? Okay, now finally, I want to call on Dr. Odegbemi to please give a 2-minute contribution. I understand you are on. Dr. Odegbemi is a consultant with LASUTH. Dr. Odegbemi, are you there? Hello, Dr. Odegbemi, are you there?
Dr. Odugbemi.
Okay, Odugbemi, sorry about that.
Babatunde Odugbemi is a consultant and criminalist
please,
department.
Okay, please, are you on? Okay, in the absence of that, finally, I want to,
Hello.
give the, okay.
Okay, yeah, Odugbemi is there. Tunde, please speak.
Yeah, yeah, Dr. Odugbemi, yeah, we are waiting for your contributions, yes.
Can I speak?
Yes, go on. We can hear you loud and clear.
The issue is this. You cannot clap with one hand. The journalist, my name is Tony, the journalist cannot write without collaboration from the government official. Those have the necessary data information. I've refused. Right now, during the NSAS protest, all 3 of the testing centers in Cross River State were destroyed. More than 4 weeks now, the Cross River State government, the Commissioner for Health, had refused to tell how much will it take the state government to restore those facilities. So the COVID-19 war here, there is no war against COVID-19 Cross River State. The medical doctors in Cross River State have been on strike for 3 weeks now because of the incessant kidnap of medical doctors. And the statement of NMA agreed to give me an interview. For 3 weeks now, I've been running after him. He has refused to grant that interview. That's the problem. Then in Akwa Ibom, some correspondents were working with the state government, about 18 of them contracted COVID-19. After they were treated and discharged, the government technically barred them from coming close to them. Where did they get those? They get those COVID, they contracted that virus through the government house. The government, after reporting these people, remember this, journalists are not insured by the state government. They are working with the state government. The government technically barred them. I think there is politics in COVID-19. The government, the various state government are deliberately not giving the right to make testing more people. It's deliberate. But I can bet you now, if federal government say for every state that had a COVID-19 positive person, you'll be given 1 million naira, you see that like what they did in primary school enrollment, the number of people testing, the number of people will rise up. It's there's business going on in COVID-19. That's why many Nigerians don't believe. Many Nigerians believe that COVID-19 is a business by government. The people don't trust their government. And number 2, why many Nigerians don't believe in COVID-19 is that our belief system. Many people believe that COVID-19 is either a spiritual attack or witchcrafty, and those are the issues. So it's not
that has been said, Mr.
The
Tony.
journalists cannot report. what an authority cannot substantiate.
All right. Thank you so much, Mr. Tony. Mr. Tony is from Southern Examiner. And please, finally, if we still have Dr. Odugbemi on the line, Dr. Odugbemi, we are waiting for your contribution, just about 2 minutes contribution. Just tell us what you think are the unreported areas of COVID-19. I can see you are on, but you're not saying anything. Babatunde Odugbemi, Dr. Babatunde Odugbemi, are you there?
Problem with his network.
Okay. Okay, no problem. So please,
okay, no problem.
Yeah. Okay. Then, is there any consultant? Okay. You are on now, right?
Oh, he says he's got the problem with his mic. So
okay, the problem with his mic. Okay.
Yeah.
Okay. I think we are done with that, and then just in case any, I'm giving the final chance for any consultant, any senior registrar, any registrar that might want to say anything, should do that quickly. And in the absence of that, I want to say thank you so much. I think it has been a very robust discussion today. Oh, I can see Aro Leonard was a former director training in the BBC. He has joined us. Thank you so much for this, and we want to believe that this is not going to be the last that we will have of this series. I want to call on the HOD of primary health care, that's the Department of Primary Health and Community Medicine in LASUTH, to give his final remarks. And of course, Professor Olumiwa will also give his final remarks. Dr. Adeniran, are you there?
Yeah, thank you so much, Dr. Iwana, for this opportunity. And I also want to appreciate all the speakers. Dr. Alero Robert, thank you so much for your wealth of knowledge. Thank you for contributing. Thank you all the professors that were able to join. We really learned a lot. We also learned from the medical perspective. I think we learned a lot. I thank all the consultants from our department, the senior registrars, the registrars, and I also thank Professor Dusoya for taking time, to also be part of this project. I believe it's something that we should continue. We should continue the conversation until we get to the promised land, hopefully. Thank you so much.
Exactly. All right, sir. All right, Prof.
Thank you. We're grateful. I believe we can do a whole lot more together. And let's not stay at complaining. There will be problems. Human beings only do two things: create problems and solve problems. So let's decide to be more on the side that solve the problems. Let's diminish the capacity of those who are creating the problems. There will be politics, there will be all sorts of issues. But by doing good at each local point, I commend all the media houses who have kept and like somebody said, what are the issues? We've uncovered them today. So I expect media gurus to go back and say, okay, Prof talked about issues of secondary effect. Can we start doing issues about it? Can you focus group discussions? Can you work with people in sociology? Can you work with people in public health? And let's all begin to contribute. I've put on the chat now a very prestigious journal that's available. We've got 5 articles in that current edition on COVID-19. Those are things that the media can read and bring to the fore and talk to the authors. In the Lagos Research Group on COVID-19 has done a lot of good work to present information about COVID in Lagos and in Nigeria. So the more we can do those things, the better for us. Thank you, everybody who has come, all the media people, all my colleagues in APHPN and our department. I'm very grateful, and God bless you. Have a wonderful evening.
Thank you so much. And then Mr. Idris Adeshino, can you, on behalf of the journalists, can you give a closing remark? Hello, Mr. Idris, are you there? Okay, I think Mr. Idris has gone. So thank you so much.
Hello?
Okay, go on.
Yeah, I think Dr. Akriti should be able to do that, but since it's not available now, I want to say a big thank you to all the professionals who are here. We have been richly endowed with your information, and we want to, because these are the information that we for in the United Kingdom and elsewhere in Europe. They are free for us in Africa. We should appreciate that. Thank you so much. And to our colleagues in the media, I think the challenge is for us to do more. And I hope we will embrace that. Thank you so much.
Thank you so much, Idris. And thank you so much, Professor Odusonya, Dr. Adeniran, Dr. Alero, and of course, Dr. Ogun, and everyone, the senior registrars, the consultant, the registrars, and of course, all our journalists, and of course, my immediate past HOD, Professor Abigail Ogwezi, for staying all through the program, and of course, my postdoc supervisor in Howard University, Professor Chuka Onwemechili, and the rest of my former colleagues in Radio Nigeria, and of course, some of our colleagues in University of Lagos. I'm talking about Mass Communication Department. I can see Dr. Lawrence from Chemistry Department, University of Lagos, and a whole lot of you. The conversation would be continuous. So we look forward to having more robust romance. I'm talking about professional romance with LASUTH after this. God bless you. Bye-bye.